This was the PowerPoint presentation that didn't quite fit on the screen, so I've just made a PDF of it. And what I'll do, I'll put this in the group after this session, so then you'll have a copy of that in the group as well, so you can print that off for your revision. Cool. So yeah, we've looked at the first cranial nerve 1, 2, 3, 4, and then 6. Because of the jobs they do, they kind of work together. So we've covered 1, 2, 3, 4, and 6. And today we're going to do number 5. We learn those separately, usually because of the jobs they do. So olfactory, obviously smell, and then optic, just vision, and obviously to do with sight and reflexes of the eye. And then when you get into the oculomotor, trochlear, abducens, then those all kind of control the eyes. So whether it's with autonomic or somatic motor control. So that region is kind of done now. However, we have got some contributions to those regions from some of the other nerves as well. So there's a lot of overlap with the cranial nerves, and makes sense that there would be overlap, to be fair. But there are some key things to look for, key areas to test to identify whether there is a problem with the nerves. So let's have a look at this one. So this is the trigeminal nerve, and gave you a bit of a warning last time that this is a bit of a tricky one. Let's have a look at this. So this table here, this is from that PDF that I showed you right at the beginning. So we're on to cranial nerve number 5, and it's trigeminal. So there are 3 branches of this nerve. We're gonna go over this in a really good textbook by I want to say his name's Whitaker. I'm pretty sure it's a guy called Whitaker. I'll post a link on the group later. He does some really, really good schematics of the body. So it's not actually where things go. So it doesn't follow exactly the pathway of things. But what it does do is it gives you like a tube map. Yeah, so it lays everything out in 2D. Because obviously if it was all in 3D and it was where it was supposed to be and lining up to where they should go, it will be so difficult to work out what was what. So what they've done is they've kind of taken the nerves and then spread them out and put it in a tube map style, so you can see where things go. So I'm going to show you some of those images today and overlay them on the videos. And what I'd recommend is when I show you the main picture is take a screenshot of that, or take a photo on your phone, so that you can use that during this session. Because when we get to the videos, I'm going to just use sections of it. Otherwise, it just gets a bit too overwhelming. So yeah, take a photo of the screen when we get to it, and then you'll have the whole schematic, and you'll see which bits we're looking at with each video. Today, what we're going to focus on, if we have a look, yeah, here we go. So we've got the mnemonic ooh 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 to touch da 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 da, and we've got this but here, so the B. So some say money matters, but so this is cranial nerve 1, 2, 3, 4, 5. This is the way to remember whether it's sensory, motor, or both. So sensory, motor, both. This trigeminal nerve is both. And we've got general somatic sensory, so basically sensation for the skin, and special visceral motor. So it activates glands and things like that, so the visceral organs rather than skeletal muscle. So sensation to the face, mastication, although there is some motor as well with this as well, with the muscles of mastication. So your main test for this, if you're going to test the trigeminal nerve, is sensation to the face, and I'll show you the tests in a second. So that's a bit of an overview of it. So if we have a look here, we've got skull exit points, we've got the superior orbital fissure, and we've seen that before. That's an exit point for nearly all, apart from the optic nerve, of the previous cranial nerves. It comes out the back of the eye, so that's one exit point. So that's the first part. So sometimes these are labelled V, VI, V2, V3, so like Roman numerals, but then they look a bit like 6, 7, 8. So sometimes these are labelled VA, VB, VC. So it all depends. So number 1 here, so the first branch is through the superior orbital fissure. And if you have a look here, these are the branches. So ophthalmic, maxillary, mandibular. So those are the three branches. These are the three branches of the trigeminal nerve. If we link the two together, so superior orbital fissure is your ophthalmic. Your foramen rotundum, we'll talk about these in a sec, is your maxillary. And then your foramen ovale is the mandibular. Those three exit points, and you'll see it in a sec when we have a look at the dissection, they start as one big lump, and then they branch off into three nerves, and they all go through a different exit point. So what we're going to do is we're going to follow the pathway of each nerve at a time. And I reckon today we will probably just about get through the ophthalmic. Yeah, there's because off of these branches, there are then branches. So it does get quite confusing. So I'm just going to break it down bit by bit, and then so you can see each section. So 1, 2, 3, 4, fifth cranial nerve, which is butt. So some say money matters, but my brother says big biceps matter more. So those are your 12 cranial nerves. This is cranial nerve number 5, which means, so you got the butt there. This is both. So it's both sensory and motor. Let's have a look at these. So the trigeminal nerve, obviously tri means 3. These are the areas that it supplies. So sensory to the face, the nasal cavity, the cheeks, the lips, the skin of the mandible. So kind of all around here, all here, and all around here. Basically all the sensation for the skin, that it does all of that. And then motor, the motor part of it, the muscles of mastication. So your temporalis muscle, your masseter muscle, which is in here, and then the pterygoids, which are kind of tucked in underneath there. So those three muscles this innervates, plus the anterior belly of the digastric. So if you remember, these were the muscles that came underneath and formed the floor of the mouth, okay? And then the mylohyoid. So when we looked at the hyoid bone and the hyoid muscles, this is the nerve supply for those two. It links in with that session that we did previously. So if you have a look here, we've got blue, green and red. So blue is sensory. So the ophthalmic nerve is purely sensory. The maxillary nerve is purely sensory as well. And then the mandibular nerve is sensory and motor. So V1, V2, V3. So see what I mean? Sometimes it's labelled 1, 2, 3. Sometimes it's cranial nerve 5, so the V, and then A, B, C. There is some crossover with the notation that's used. So we've got the origin up round here. So you've got the three nerves emerging as one initially, and you've got like this big lump where they emerge from. And then they branch off and go through the different skull exit points. So the ophthalmic nerve, which we're going to have a look at today, that covers all this area around here, up into the top of the head, around that area, around the nose, okay, inside the nose, all around that area there. So we're going to follow this branch today, and see where it takes us. If we get time, then we'll go on to maxillary, but I don't want to overload you because there's quite a lot to cover. So yeah, this is just a similar kind of image from the last one, but obviously your brain here. So this is where your trigeminal nerve emerges from, and then you've got the ophthalmic coming up towards the eye, the maxillary, so the maxilla area, so this area around the face, and then the mandible or mandibular is obviously the jaw, around the jawline. And yeah, when we get to the mandibular, man, it's amazing where that nerve goes. It's absolutely crazy. So yeah, we're going to have a look at the ophthalmic today. They all come from this area here. So remember, the cranial nerves are named in order from anterior to posterior, and there are 12, and we're on number 5. So we're pretty much halfway. The next one back will be the halfway point. So this is another good picture. So you can see the trigeminal ganglion, which is just here. So like a thickening of the nerves, and then it splits off into the 3, and you can see the branches then coming off. See the ophthalmic one here, maxillary there, and then this is the mandibular one here. So we're going to be focusing on the ophthalmic. The ophthalmic is sensory for the skin over the upper eyelid, up around that area there. For the cornea, you get a reflex action. If anything goes towards your eye, you obviously get a reflex action to close the eye. Over the upper eyelid, cornea, yeah, lacrimal glands. So it helps to produce tears. The nasal cavity, the nose, the forehead, and the anterior scalp. So all of that green zone area there, that is supplied by the ophthalmic. So the sensation to the skin in that area. So if you touch your forehead, the reason why you can feel yourself touching the forehead and around the eyes is because of the ophthalmic branch of the trigeminal nerve. Cool. So where does this ophthalmic branch go through? So this is where the olfactory nerve comes through. So we had to look at that before. There's the optic canal. So that's where the optic nerve will go through. And then we've had a few nerves come through this area already. So we've had the trochlea, the abducens, and the oculomotor all come through that area there. The superior orbital fissure. So it's like a crack. And that then comes through here. So obviously if you took someone's eyeball out, that's where it comes through. And that is why it then gets to the back of the eye and then wherever it goes. That's where the ophthalmic branch of the trigeminal nerve will come through. And then this, really sorry about this one. This is the time to take a picture on your phone or a screenshot, whatever you're watching on, of this bit here. This is from that book, Instant Anatomy. And what I'm going to do is, as we go through the video, I'm going to overlay sections of this onto the video so that you can see which bits correspond to which. And yeah, so if we have a look here, we've got the ophthalmic branch. So that's this bit here. We've got 3 splits. You've got the frontal branch, okay, and that goes to forehead. You've got the lacrimal branch. This is for tears and sensation around the eye. And then you've got this one here, the nasociliary. The nasociliary branch is the nose and sensation for the eye. And then we've got different branches coming off here. It's the ciliary branches coming off here. These provide sensation to the eye. And then we've got these ones here called ethmoidal, okay? And these are sensation to the nose and the eye. I just wanted to show you this before we go on to the next bit. If you're thinking, oh my God, that is loads, it is. But I'm going to break it down bit by bit and then show you how the dissection relates to this model. So this is just a model. So the nerves do not follow these pathways. What they've done is that because if they followed the pathways, then they all mix up together and they're too difficult to understand. So this guy has drawn them out like a London tube map. So that you can see where everything comes from and then where it goes to and where the branches are. The branches on here do not match real life, okay? They're just there to help you study that region, okay? So don't worry if it doesn't match because it's not supposed to. Right, here we go, hopefully. Here we go. There we go. Get my pause button ready. We're going to need to pause a lot on this video, I think. Ophthalmic, here we go. So I'll pause there. Let's start there. So hopefully you will kind of remember this already. This is a view of the top down through the skull. So the brain has been removed and we're looking at the kind of shelf where the brain sits in the skull. Okay. And then this glistening stuff all around here, this is the dura. So this is the dura that surrounds the brain, part of the meninges. Remember there was the dura mater, the pia mater, and then the arachnoid layer. And the dura is the durable layer, so the tough mother, basically. That's what that means. And obviously from the brain through to the eyeballs, the nerves have to pass through the dura. So, and I described it last week, like you've got a wire coming through like place in the wall or something like that, and then you want to seal it to another wire, so you get a piece of plastic wrapped around it, and then you heat the plastic and then it shrinks and then seals the wires. And that's basically the same as this. Where this nerve goes through, it's cocooned within the dura, so there's no route for external stuff to get into the brain. Okay, it's all sealed, but you have to have points where the nerve comes out, and that this is where they will. We're looking at this one. We're looking at the superior orbital fissure because that correlates with this here, the ophthalmic nerve. okay? And yeah, we're going to follow the pathway of that now. So let's have a look at that. So this is very, very close to where we've been over the last few weeks. So there's the trigeminal nerve and where it exits from the brain. That's where it goes to. So obviously that's been cut there, and then the brain removed. So that we're gonna track that now and see where it goes to. This region that's just about to highlight up here. Here we go. So this is your trigeminal nerve, basically. So you've got this big lump here. So these are very different to what we've seen before. So previously, the nerves were quite slender, and you had a nerve to do a specific job pretty much. These ones have got such a massive job to do. You can see the difference in the thickness. Yeah. So where there are more axons, especially here, the sensory axons, coming back with feedback from all of the face, they're obviously bigger. We've got thicker nerves around here. So this lumpy bit here, that's the ganglion, and so that's the thickening part. And then these are the branches coming off here. You got 1, 2, and then 3 just there. And that relates to ophthalmic, so that one there. Maxillary is that one there, so that's your second one. And then mandibular, that one. And it makes sense where they are because of where they go. So ophthalmic's going towards the eye and the forehead, maxillary's going towards the cheek, and then mandibular's coming down towards the jaw. So they're angled and they'll exit the skull to go to the areas that they need to go to. Okay, so let's follow that through. Just move that out of the way. So, that was really quick. There we go. There's your ophthalmic, maxillary, and then mandibular. Those are your 3 parts of the trigeminal nerve, and we're going to follow the ophthalmic branch this first time. So ophthalmic, maxillary, and mandibular. And then there's your trigeminal ganglion. So that's the thickening part of or thickened part of the nerve. And obviously that's going to be the same on the other side as well. So it'll be paired on that other side. And then here are the exit holes. The trigeminal ganglia sits on here, around that area there. And you can see that hole there, that one there, and oh, there is another one there that you can't see so well. Yeah, so we'll have a look at where these go. Ah, there it is. Yeah, okay, cool. So that's your superior orbital fissure just there. So that's at the back of the eyeball. That's what we've been looking at over the last few weeks with the abducens, the trochlear, oculomotor. Those 3 have already gone through that area. So we've got another one going through this fissure as well. You'll notice that there's a little hole here, and the shape of it is round. So, and if you live anywhere near Birmingham, you will have heard of the Rotunda, which is a building that is circular. So the Rotunda building is quite a landmark in Birmingham. So rotund or rotundum, that means circular or round, okay? And then we've got another hole just here, which is more of an oval shape, so ovale, okay? So if you have a look down here, superior orbital fissure is the first one. The second nerve, so the maxillary nerve, goes through the foramen rotundum, which is the round hole. And then the third one, the mandibular nerve, or mandibular branch of the trigeminal nerve, is the foramen ovale. So foramen means a hole. Oval hole, round hole, and then upper, like crack, fissure. Those are your exit points. So there's the ophthalmic one. There's the rotundum. That's where the maxillary branch is going to go through there. And then just down there, foramen ovale. So that's your oval hole, okay? And that's where they all go through. So the ophthalmic nerve will go through that fissure, just there. Okay, cool. Right, let's just pause this here. If you did take a picture of that original schematic, that bit there is coming into this bit here. Okay, so that's the ophthalmic branch. So there's the ophthalmic branch coming through there, and then it splits into 3 other branches. So you've got frontal, lacrimal, and nasociliary. Those are the 3 main branches off of this ophthalmic nerve. okay, or the ophthalmic branch. So let's have a follow that through. So this is what I've tried to do with this. Let me just hold that there. Cool. Okay. So this is the top of your eyeball. We've had a look at this before when we had a look at the oculomotor nerve. And then there is, lying over the top of the eyeball, this is your frontal nerve. Okay. And if you remember, the ophthalmic was purely sensory. So this is a sensory nerve that is going over the eyeball and then towards the front of your head. We're going to follow that through in a sec. So if you have a look at the frontal here, so that's the frontal. This is a branch of the ophthalmic, which is the frontal nerve, and this is where it goes. You got through the superior orbital fissure. We know it's already gone through that point, and then it splits into another two branches. We've got supraorbital, so above the eye socket, and then we've got this one here, which is supratrochlear. Okay, these are sensory nerves that will supply this area of your head. Let's have a look and follow that through. So there goes the frontal nerve, and then it supplies this area here. It supplies sensation to the forehead. Let me just go back there a second. There's going to be lots of intricate bits to this, so I'm just going to pause it there. There we go. Okay, these areas here supply sensation to the forehead, so you can see it's coming over the top of the eyeball, and then it comes through here. Okay, can you see those bits there? So it supplies all that area there of your forehead. Okay, yeah, and that's that branch basically. So that frontal branch that comes off of the ophthalmic through the superior orbital fissure over your eyeball to get to the front here, and then up, and then supplies your forehead with sensation. Okay, let's have a look at the next bit. This next bit, we're going to have a look at the lacrimal, I think. Yeah, it looks like it. Here we go. Cool. Just pause that there. So we've done this one. So that was the frontal. So the frontal came over the top of the eyeball and then out the front. This one here, this lacrimal, it goes through that superior orbital fissure again, so it follows the same pathway as the frontal part, but it goes towards the lacrimal gland. This lacrimal nerve here goes towards the lacrimal gland, and the lacrimal gland is your tear-producing gland. So if you get something in your eye, automatically you will start producing tears, and this will be one of the nerves that is responsible for that. Okay, let me just pause that there. And then the last branch down here, so this is the nasociliary branch, okay? So we've got a branch that comes, so it's split, the ophthalmic splits into three. You've got frontal, lacrimal, so frontal coming up here, lacrimal to your tear duct, and then the nasociliary, that supplies all this kind of area here, okay? So this nerve here goes towards the nasal cavity, okay, goes into that region there. Let me just play that for you. And then those are your ethmoidal nerves. Let me just go back a second and then pause it at the right place. So nasociliary towards the nasal cavity, and then there we go. So these are your ethmoidal nerves, and that's this branch down here. Okay, so this branch down here supply kind of all your upper teeth and around that area there. It comes down and then into the nasal cavity, and then onto the top of your teeth, obviously on the inside. So through your eye socket, basically. Okay. And there's the infratrochlear. So that's that little branch just. Let me just pause that a second. Ethmoidal, and then there. Yep. So that's this little branch off here. So you've got infratrochlear branch as well. Okay, which is that nerve there. So there's lots of stuff going on here. Let me just pause that there a second. So yeah, then we've got the long ciliary nerves. So these are a branch of the nasociliary, and they're coming off here. So if we have a look, this is to the cornea and the papilla, so the pupil muscles. So we've got a couple of branches for those. We've got long and short ciliary nerves. So let's have a look at those. So those are these ones here. Look at that. Yeah, so that's going to literally into the back of your eyeball. So this is where they come through. So there's your frontal. Just pause that there. So it comes over the top of your eyeball and then out there. It's literally coming up that part. So a sensory nerve right there, and then it just spreads out over your forehead. So that's these ones here. So we've got supraorbital and then supratrochlear. So sensation for the forehead. Frontal nerve comes out around here, around that area there. Let me just play that a little bit more. So there we go, supraorbital and supratrochlear. Okay, so these are the regions. So all around there, that's where your sensory nerves will come out. So like I said, it's gone over your eyeball, okay, and then come out there, and that's part of your frontal branch. So it supplies that region there. So this is the reason why it's useful to know this kind of stuff, because if you do sensory nerve testing for the face and you just willy-nilly just do the sensation test and you don't really understand what supplies that region, then you don't really understand the test. So we know that if we do sensation and we've lost sensation around that area, then it's likely that there's an issue with that part of the trigeminal nerve. Okay. Perfect. Cool. So that is your ophthalmic branch. So if we go back to this was the overall picture. So we've got frontal, so that was the one that came over your eyeball and then up through here, and then that supplies the forehead sensation. So hopefully this schematic will make a bit more sense now. The lacrimal goes through that superior orbital fissure. See, I really like these. It shows where they go through, but like I said, that like these will be pretty close to each other, but it shows them separated so you can see things a bit clearly. And then it goes towards the lacrimal gland, so tears and sensation around the eye. And then the nasociliary will branch off. So you've got long ciliary, which will be sensation to the eye. And then down here, where you've got the ethmoidal branch, that goes towards your nose. Ethmoidal branch of nasociliary, nose and eye sensation. All right, and you can see all the bits that they innervate. So if you have a look here, we've got some things that we've seen before. So the cribriform plate. Okay, cribriform plate. So that was where the olfactory nerve came through. So the nasociliary, the ethmoidal branch of the nasociliary will follow the same pathway as the olfactory and go through the cribriform plate. So that's like literally right behind there. Okay, and then drop down into your nose. So there are some shared nerves that do a similar job. I'm now going to have a look at the second branch of the trigeminal, which is called the maxillary. So trigeminal means triple. We've got 3 branches, mixed cranial, so we've got 2 sensory and 1 sensory and motor. So remember, the ophthalmic was purely sensory, the maxillary is purely sensory, and then the mandibular is motor and sensory. We know that this next one is going to be purely sensory as well. The trigeminal nerve is the largest of the cranial nerves, and it's split into the ophthalmic, maxillary and mandibular branches. So we've obviously had a look at ophthalmic. We're now going to have a look at the maxillary. So the maxillary is a sensation for the nasal mucosa, the inside mucus of your nose, the palate, so the upper part of the roof of your mouth, your pharynx, your upper teeth, upper lip and lower eyelid, all around that area just there. Okay, so if you know anyone who's had a bang on the head and they've had an eye socket fracture, and then after that fracture they've lost sensation around here, I know someone, it's my wife, has had that, then this is the nerve that's been affected. And that's one of the things that's actually been quite fascinating, just revisiting this stuff, because I've been able to really pinpoint exactly where the problems are with my wife's head injury. So, and quite often you're driven by that stuff, aren't you? So when it's it's personal to you, or you know someone who's suffered from it, then you want to find out a bit more about it. So yeah, hopefully, well, those kind of things don't happen to anyone you know, but if they do, then you will know the kind of things that are going on. Okay, so let's have a look at this. I'm just going to pop me out of the way there. So the maxillary branch goes through the foramen rotundum, the round hole. Okay, a bit like, was it play school with the round window? So we've got the superior orbital fissure where the ophthalmic went through, so that's back of the eyeball. The foramen rotundum is just underneath that. So if we have a look here, this is a view through the eye socket from the front. So you've got the superior orbital fissure just there, and then the foramen rotundum is just underneath it. Okay, just there. So it comes through the back of the eye socket again, and then it comes out like underneath here. This is called the zygomatic arch. So where your zygomatic arch is, it's kind of underneath that bit there. Okay, that's where it comes through. So that bit there, you know, your cheekbone area, that's that just there, and it's underneath that bit. In fact, yeah, there is part of your mandible. If you open and close your mouth, you'll be able to feel your mandible. It's, in fact, if you put your finger in your ear, open and close your mouth, that's where your TMJ is. So there's your foramen rotundum exit point just there. So you can see why it's called maxillary, because it coming through this area here, it's bound to be supplying this region here. So again, the exit point makes sense for where it supplies. Okay, number 2. Look at that. This is a complex tube map. So if we have a look where it all kind of starts from, there's your foramen rotundum, just there. That is the exit point for your maxillary nerve. And then look what happens to it. There, okay? So there are many branches to this maxillary nerve. And again, they don't look like this in real life. They've just been spread out so they're easier to see. But if we have a look, I've kind of highlighted the main branches. So we've got zygomatic branch. So the zygomatic branch goes to the lacrimal gland. We've got another one for tears. Skin of the temple and the cheek. So around that area there, supplies sensation here. So if you lose sensation to your forehead, that's going to be ophthalmic, well, the frontal nerve. And then if you lose sensation here, that's the zygomatic branch of the maxillary around that area there. So when you do sensation testing, you can kind of work out where the problems are. There is some overlap with some other nerves as well. So basically we would know that something isn't right. Okay, and then they would be further tested. So infraorbital branch, so inferior, orbital eye socket. So underneath your eye socket branch, there are these nerves called the alveolar nerves. And these supply your teeth and your nose. So up around this area and down there. Okay. Then a little bit further down, so we've got another branch coming off here. And then this splits off into different branches as well. So these are the palatine nerves, so serving the palate. And you'll see here we've got different names for them. So nasopalatine is the nose and the palate, makes sense. Greater palatine is just the nose because it's higher, and lesser palatine is the palate because it's lower. You can see why they're called what they are because of where they supply. So let's go through those again. So zygomatic branch is at the top. So this is going to supply the lacrimal gland, the skin of the temple, and around the zygomatic bone. So this bone around here. The alveolar nerve will come down onto the teeth and into the nose. Nasopalatine, nose and palate, so the roof of your mouth. Greater palatine, nose, lesser palate, so roof of the mouth again. Okay, so yeah, very, very similar with the ethmoidal nerve coming around that area. So we've got a bit of a crossover supply there. So let's have a look at that one. What time are we on? We'll just do a brief introduction to this as well. And purely sensory. So this seems to highlight to me at least why people really enjoy a head massage, all those nerves to play about with. Yeah. And they're really superficial. There's no tissue here. okay, especially on the forehead. Round here there's a bit more, but the sensory nerves, the cutaneous nerves, are going to be really really superficial. If you took a picture of the main schematic, we're looking at this area here. This is the pterygomaxillary fissure. So if you have a look, that's where all your teeth attach into, and then around this area here there's a crack in between that, and the nerve will come through that crack. That's well, we'll have a look at the branch for that in a sec. So sphenoid bone just there. So all around there, the orange is the sphenoid. This is all the maxilla, and then that's the gap in between. There it is there. Let me just go back. Just pause that there. There we go. Yeah. So the pterygomaxillary fissure, which is that bit just there on the schematic. So you can see it's kind of coming out that bit there from the inside. Obviously, can't show you that on myself. There we go. So it's a continuous gap, this fissure. So you've got loads of gaps in your skull for things to pass through. So a continuous gap with the infraorbital fissure. We've had a look at the superior orbital one. Just if I've got my skull here. Yep. Yeah, there we go. Let me just switch us onto the main screen a sec. There we go. You can see that bit there. See where my finger's kind of poking through. So that's the superior orbital fissure just there. And then if I angle it right, yeah, there we go. You can see it there. Can you see that bit there? That's the infraorbital fissure. And then you can actually see that perfectly round hole just there. So that's the foramen rotundum. Where it comes through there. Just above my finger there. So infraorbital fissure, superior, and then foramen rotundum just there. And if we come around here, see, this is the best way to probably learn all this on a model. So you can see that it'll be around this area here. We've got sphenoid bone, maxillary bone, and it's in there. Okay, that's where we're looking. So obviously, but face there, it's going to be sort of in that bit around there, just underneath that zygomatic arch. It's actually a zygomatic arch, so tucked underneath there. Okay. So that's the area that we would just been looking at. And again, there are holes here that there aren't on the models. So sphenoid bone, maxillary bone. There we go. And then that's the pterygomaxillary fissure. So that's the gap there. So it's just down there. Okay. Okay. Ooh, let me just pause that there a sec. Just go back. Here we go. Okay, cool. Now, so that's that bit. So the pterygomaxillary fissure, so just there. And then it's continuous with this infraorbital fissure, just up there. And can you see there? Infraorbital fissure. So through that gap is where the zygomatic branch will come through. And again, this is what I like about these. You can see where things pass through. And then we've got this zygomatic branches that come off and supply this region here, so the temple and the skin over that bone. Just see if we can get a better picture of that. Yeah, so that's that bit there, the infraorbital fissure, and that's what we just looked at. There we go. So this is what we just looked at on my skull. There's the inferior or infraorbital fissure. The superior one is just up there, and the foramen rotundum is just in the middle there. Cool.